Good morning, everyone, and welcome to the first session of today's event, where we will be discussing mental health and social media in an ever-changing world. My name is Emma Cooke. I'm Business Development Manager for Zevo Health. I'm delighted with the opportunity to introduce you to our first speakers this morning, Professor Jim Lucey and Dr Colman Noctor. Both remarkable characters and experts in the field of mental health and well-being. Professor Lucey is the Clinical Professor of Psychiatry in Trinity College Dublin and has more than 25 years experience in psychiatry. He is the author of 2 books, In My Room and The Life Lived Well. Dr Colman Noctor is a child and adolescent psychotherapist in St. Patrick's Adolescent Mental Health Services and is Assistant Professor in Trinity College Dublin. Colman's specialist area of interest is in the role and impact of technology on our mental lives. Jim Colman, welcome. Thank you for joining us this morning. Really delighted to have you here. Perhaps to kick things off, it would be great for us all to hear a little bit more about yourselves, something maybe about your overview of your background, your experience, and really your journey of, how you've arrived to where you are today. So, Colman, I'll ask you to kick off.
I suppose I started out my career as a mental health nurse, and I still do some work in that area. And I suppose my interest was always in children and how mental health problems developed through that. And I suppose the last 20 odd years that I'm doing this, we're seeing huge changes in terms of the landscape of the world that children are trying to negotiate. And somebody started drilling here, my apologies, but the joys of remote working. I suppose as a parent of 3 small children, as somebody who's engaged with young people and teenagers, I'm just really interested in how the world is changing and how that's impacting on our lives and our mental lives, and how we see the world and see work and see family and see relationships. I'm just really interested, obviously, at the moment in our COVID crisis, to see the impact of this on young people's development and children growing up and family life. And we're seeing a lot of difficulties at the moment in terms of how people are stretched and worried about reboarding into the work environment and going back. Just fascinated to see how this all unfolds, to be honest.
Great. And yourself, Jim?
Well, first of all, it's lovely to be here. It's an extraordinary experience. So we're all doing something very novel. Certainly I am. I started out in my career having left the Royal College of Surgeons with every intention of becoming a general practitioner. I came from family generations of GPs and found myself falling into mental health care because of sort of charismatic leaders and teachers that I found in my journey as training there. People like Dorothy Keelan in the Mater and Anthony Clare in Patrick's really changed my course. And I went on from general practice to train in psychiatry in St. Patrick's and then in mental health care in London. And I may be joined here by my dog. Just I don't know how wide the angle here is.
Everyone's welcome.
And then from there, I've really spent my time following, in many ways, those people's leads and trying to find that same enthusiasm for what I think is the most important area of healthcare in respect of the volume of demand and need for people. 40% of healthcare need is mental health care, and also for what I think is the advocacy for its worth. So I think that the stigma issues are still very alive. The new techno and the new challenges are on a background of the old challenges. And stigma is still the largest one. And the biggest stigma is the belief that mental health care doesn't work. That in fact, although we all can break down, we can't all get well. And the truth of it is, many of us will break down. and very, very many of us can get well. But that truth isn't clear out there. So I see myself as somebody with passion, but also a background that gives me a position from which I can say, well, actually, mental health care works. And I don't think that's been said enough, because I think that investment, and you've got investors behind you in healthcare investment, and the direction of our funding really is looking for effectiveness, return to the community, return to work, return to home life and living. And unless we're credible in that area, we've just simply transferred the low expectations of the asylum to even lower expectations in the community.
Great, thank you for that. So I suppose really a question to you both. How have you seen mental health affected through COVID-19?
Do you want to take that one, Jim, or start with that?
All right. Well, I think mental health, the effect of it has been enormous. And one of the difficulties I think that we have to start with, like a principal sort of idea I'm trying to embrace, is that we need to try and be data-driven. At the moment, we're very much in the throes of misinformation, opinion, well-meaning stuff, and also misdirected stuff. So we need to know whether what we're saying is experience, impression, fear, or actual data. And we're very early on in that journey of finding the data. There's a really super paper by Simon Wesley and his colleagues in the Lancet Psychiatry that came out last month, really setting out a heading for research priorities. And this is not arcane or obscure research. It's really, let's get data to say what is true and what isn't, or what appears to be true and what it isn't. And that's, the great and the good are getting it wrong than that. But I think we do need to hold on to that. My impression, for example, is that people are experiencing enormous amounts of stress. And the data that's coming out already is that the background level of common mental health disorder, which would have been probably about a fifth of the population having a common mental health disorder in any one year, is doubling. So that's an extraordinary level. The even bigger loads are amongst healthcare professionals. And as we know, 1/3 of the people who've had COVID-19 illness have been within healthcare professions. And so the experience of witnessing COVID-19, experiencing it, particularly in areas where there's been high load of death, is causing enormous difficulty for people who in themselves are also vulnerable to the illness. So if you look at the Wuhan studies, 85% of people in intensive care professions are developing post-traumatic stress disorders. An enormous number of people, as a proportion of those people who are working. It's less depending on your exposure, but we now have to anticipate that people who've exposed to very great stress in the nursing home sector are likely to develop stress disorders, and also have had a high load of the COVID experience themselves. And then the wider community of people in lockdown, in quarantine, is causing a huge uplift of increase in stress disorders. And they're of two kinds. The first group will be people who are in lockdown, but who have known or acknowledged mental health difficulty. And their difficulties have been increased. Difficulties for their families have been increased. Some of those with enduring mental health disorder who are in the community with already scant and underfunded supports have had really difficult times. And then the second group is those people who have not had an acknowledged mental health disorder, but in the context of this have developed anxiety disorder, various forms of mood and anxiety complexes, phobias, fears, and quite marked distress. We'd hope that these would be remediable, but they may well actually be revealing or precipitating a degree of community mental health difficulty that was just under the surface. And it's likely that volume of people is doubling, and we'll all need to have a response of some kind. So the third difficulty is, can our services respond to this in a way which minimizes or mitigates them as effectively as I think that mental health intervention can and should be.
Colman, and what about yourself? You know, how have you seen mental health affected through COVID-19?
Yeah, I think in fairness, it's the reason for we feel anxious is when we don't know something. So uncertainty causes anxiety, and this is probably the most global phase of uncertainty we've ever gone through. The idea of timelines, and they've all been kind of arbitrary, so we're kind of stuck in a paused phase. And if you think about things that you would recommend for people who are experiencing a mental health problem, you're saying connect with people, mix, have some structure to your day, feel productive, go exercise, keep busy. None of those things are available to people at the moment. And so as a mental health practitioner, your toolkit of advice is running dry, because I mean, a lot of that stuff that we would normally encourage people to do are just not accessible to them. And I would also say that I think, you know, everything in moderation is a good thing, in terms of we have a kind of a 4 to 7 rule, that out of 10, if it's in the middle, you're generally okay. Where we run into problems are the 1, 2, 3s and the 8, 9, 10s. And we were coming from a society that we're so time poor that we were we'd 1, 2, 3 of time to ourselves to reflect and work ourselves out in terms of relationships with ourselves. And then for the last 3 months, we've had 8, 9, 10, just umpteen amounts, like too much time to ruminate and overanalyze and overthink about things. So we've missed the moderation step. But for me, the COVID issue, and especially when working with children, I don't think we'll see the impact of that until we start to go back. You know, people will say, "Oh, my kids are fine at home and they're enjoying it and grand." It's oftentimes children adopt to a new normative quite quickly, but it's returning to the normal from the normative may also be the challenge. Children have been around mum and dad for the last 3 months, probably all the time. There's been no childcare, no creches, no school. So as much as that throws out structure, it also creates kind of an enmeshment in terms of the relationship, and trying to reintroduce and reboard into those structures is going to be a challenge. And so I think it's not just when lockdown is over, the pandemic is over. I think from a mental health point of view, that may only be the beginning of it in some respects.
Yeah, I suppose I know that, you know, in the audience today, we have, you know, a lot of organizations who are looking for advice in terms of, you know, how they're going to support their employees as they navigate the prospect for returning to the workplace. You know, Jim, you mentioned it is a very anxious time for people as we navigate this process. So what would be your advice for employers to really kind of support their employees returning to the workplace?
Well, I think that the old principles still work. I think trying to create a mentally healthy workplace is good for business. It's good for society. It's good for employees and citizens. So I think we have to approach this genuinely. And you know, everybody in this forum here is on this because we're already on the page. We want to make a better home, society, workplace work for all the right reasons. But I do think we can't assume that. So I think you know, already there are you know, employment places that are struggling, you know, very much so, and adaptation will matter, and opportunities will arise for our adaptation. And I think we need to look at those carefully and support people willing to make changes. So everybody's talking about whether we will be working from home, whether we will be parenting at work, whether we will be in a new commuter world, whether we will be expected to make ourselves available in a more video and telehealth or telebusiness way. And I think we will. I don't think telehealth and telebusiness is going to go away now. I really think that the mental health world has already realized, and there's data coming from Spain, in other words, where it really has made a difference. And it's interesting that people like it. It comes with enormous difficulties. There'll be adaptations and so on. And there'll be a tech divide. There'll be a digital divide. But I don't think it's going away. It's out of the box. It's never going away again. Mm-hmm. But I think that's a really good thing. I think that in terms of employers, though, it might be worthwhile looking at some of the best data from some of the health services in Italy and Spain, where they've combined this with the interpersonal and started making it possible, negotiating with people to combine the video link, the reach out with targeted events around work or around health. And that's going to, I think, be the answer. I don't think, for example, a vaccine is going to solve the employment difficulties of COVID in any short term, no matter what. I don't think that the misinformation around therapeutics, the hideous lies of Trump around chloroquine and these things is just terrible. They're not going to be able to answer. But that's not to say there aren't answers. Of course there are answers. For example, there's now data coming out as to whether you can take a bus safely with masks, for example, and fill the bus, or whether you can go to a choir. Now, one of my pastimes is singing badly in choirs. And so I'm lamenting very much that we can't. And it looks like choirs are going to be struggling to come back. But taking a bus, I suspect, will come back quite quickly. However, will we all be commuting 3 or 4 times different directions at 5 o'clock every evening, bringing our children here and there? Colin can talk about this. I think lifestyle will change. So what I'm trying to get on this point is that for employers, it's important to be agile and look at the ways in which the targeted use of technology has actually been a benefit. And progress has been made enormously. It has been dragged for decades, actually. None of the products we're using now are new. They just were on the shelf and they could be taken off when they needed to. But I don't think we can carry on without society. We can't stay indoors on a flat screen. And it doesn't work for either an endocrinologist or somebody who wants to, not just make a sale, but really come together. Look how difficult it is in this group setting context to come together. So there's going to have to be a mix developed. And I think employers who are agile about that, enthusiastic for that, will find where the mix works and provide for that. It's been uncertain for a while, I think, but I think there's a lot of opportunity in it. Really what I'm saying.
Yeah, my thoughts on that are we need to be really careful around the language. There's 2 phrases I really don't like, which is social distancing and new normal. This isn't normal. And I think from the point of view of it's normative because we all have to do it, but wearing a mask and talking to someone isn't normal. Meters out of the way when you see somebody who's elderly coming your direction is not normal. But children especially are kind of finding this as this is the way to be. And I think in workplaces, we have to be very careful that what we have to do isn't, and what we should do isn't always the right thing to do in terms of what I'd say to you is the social connection is really important in workplaces, in everything that we do. I see my children and they're doing the homeschooling thing. 90% of the reason children go to school is to mix with their friends. 10% is to learn the stuff. Do you know what I mean? When you're just doing stuff without the social stuff, it loses all its value, and their motivation is really disinterested, and it's a real chore to get them to the table now, whereas maybe it was a month or 2 ago. I'm thinking of college students. The likelihood is, if social distancing is an issue, an auditorium of 500 people will only be able to carry 50. So from the point of view of, there'll be a lot of first-year college students who'll be doing it from their bedrooms. Anyone who's been to college knows that a huge part of being at college is an education in life as opposed to the lectures. And so what technology will probably provide us with is the necessity for our connection, but I'm not so sure it will give us the fulfillment of human connection. The Zoom quizzes and everything that were kind of hyper for the first 2 weeks of lockdown soon died away. And my worry is that our social muscle is something that we need to keep using. And I find it myself over the last number of months, I'm looking at saying, I must contact so-and-so. And then I'm kind of going, but what will I talk about? There's no sport on telly. I'm not talking, my life is fairly busy, but dull at the moment. I have no holidays planned. And so the thought of socially engaging becomes much more of a chore than something to be enjoyed, which I will avoid. And the longer I avoid it, the more difficult it will be to re-engage with it. And so just because we can bypass social nuances and social pleasantries, it might gratify the need that the work gets done, but it may be not done in a fulfilling way. And the fulfillment of, like, Jim and I work in the same place. One of the highlights of my day is meeting Jim at the coffee machine, and we discuss everything that's not work related. Do you know what I mean? Whereas when we're on these meetings, it's about just staying on task and what are we talking about. And I think workplaces just need to not adopt a new normal and make it normal because it's normative because everyone's doing it. It's not normal in the sense of it's not the right thing for us to do mentally, psychologically, and socially.
Yes, really, some quite insightful. Colman, would you talk to us a bit more about the effects of social media on our mental health, especially during this time?
Yeah, I mean, we're constantly asked, is technology good or bad? And the reality is it's both. And from the point of view of it, obviously through COVID, we've seen how FaceTime has managed for grandparents to stay in touch with their grandchildren, to see them on the screen. It has been a lifesaver in many ways in terms of keeping people connected, etc. And there's lots of ways in which we can use technology for good. But my belief is that when we use technology, it must be on our own terms, not on the terms of the technology companies. So if you're being dictated to, and what technology and social media does is sometimes it hacks our psychology as opposed to it improving it. So if you're getting notifications to check your Instagram feed 25 times a day and you spend your mind going through that and it erodes your self-worth and all that, that's a bad use of time. Whereas an hour on YouTube learning a tune on a guitar is a good use of time. So the notion of screen time being a reasonable kind of currency for this is not, it's not what you do, it's not time spent, it's time well spent. So we need to actually be the adults in the room and embrace technology to use it so that it benefits us on our terms. But what happens is oftentimes the lizard brain that we have gets sucked into, and we spend much more time, playing Candy Crush than connecting with our cousins in Australia and all that sort of stuff. And so the issue being is that there's good and bad to it, but it's maybe not bad technology, it's bad usage. And I think maybe some of the things we've seen over COVID is that we've used technology to benefit our lives as opposed to being kind of drawn to it or magnetized to it. And the one thing I'd say to you is that the technology narrative is based around gratification and convenience. It's not about meaning and fulfillment. And I just remind people that the easier things become, the harder things appear. So from the point of view, I always tell the story, I went to pay for something about 6 months ago and I went to tap my card, and this is pre-COVID, and the girl said, "I'm sorry, sir, the tap is broken." Or it's not working. And I gave her a look as if to say, "You mean I have to press 4 digits? And it was like this ridiculous thing that I was kind of getting annoyed about. I pressed 4 digits 6 months ago, no problem. Now it's a problem. And so for the easier things become, the harder things appear. And we've got to kind of understand that relationships, emotion, and connection is not something that we can bypass and go quickly to the outcome. It's about the process. It's about the meaning. It's about the fulfillment. And if we get overswayed by the technology and social media narrative, we may have an expectation that it's going to be easy. And very simply, a formula for happiness is expectation minus reality equals happiness. And what happens is, unfortunately, social media and technology drives our expectations really high, but our reality creeps at a pace much lower. And the gap between our expectation and our reality is the potential we have to be anxious, unhappy, and disgruntled. And so maybe it's not about changing our reality, but maybe changing our expectations. And sometimes we need to stand up and challenge the expectation of technology and understand that human life, emotions, and connection, and family and relationships are not as smooth as sometimes technology would lead us to appear.
Jim, do you have any insight on that?
Well, I mean, I'm just saying that I also miss my my coffee mornings with Colman, and that's really the key. Take so much to take out of what he's just said, but I'm still at that moment. For any of us who are shy or naturally reticent, there's a moment where you say, "Gosh, I don't have to go in. I can put my gear down here." And it would be a mistake to think that there isn't a sneaking, regard for the idea, well, I can possibly work at home and maybe I can get it done. And for employers, they need to understand that you're dealing with a range of personalities. And we have so much in common, but we're all unique. Ultimately, though, yes, 90% of certainly 70% of clinical communication is non-verbal. And I would agree with Colman, college, school, play. These are all things that actually are naturally intimate in the sense of being proximal with people. And you can't create that. You can do your darndest to be virtual reality, but I think it would not be a new normal I would look forward to having, my ball of malt that I like in my local pub delivered on screen. That's not why I want that. I don't. I'm not. That's not why I'm there. So I think this normative and normal or new normal language is something we really need to think about and tease out. So I do think we will get back to being social. I think that, if you take this media, it's like the introduction of the internal combustion engine. We stopped using horses, or in fact, we maybe stopped walking, and lots of things were, consequences were. But we did keep moving around, and we did keep moving towards each other. So I don't fear technology, but I don't believe it's an answer to the timeless universal needs for love and intimacy and proximity and compassion and meaning and all those things that are there. Yeah. However, I don't think that fear of the technology, or indeed fear of COVID, is helping us. Fear of COVID has led us to deny COVID, to lead the leaders in the Northwestern world to be slow to learn what they knew in the Asian world. They moved quickly. They didn't have any difficulty in understanding the potential of a virus to destroy a society and an economy. And our leadership was in the better half of the northern world, tardy response, but only in the better half. We need to learn, and we can learn that proximities probably need to be conscious of things like how we breathe on each other. Okay, so maybe the open plan office needs to be relooked at. I think those lecture themes can be used. I'd like to think we get data to see, well, okay, if they're not all singing in this place, they can share Zumba classes apparently. They may be dangerous. I don't know. There's very poor data sets, but I'm saying, what is the gym dangerous? We don't yet know about what we could do though. And here's my suggestion. I think we need to have a rethink about how we are societal. But bear with me for a second, because when you're on these kind of things, and I'm talking to you now, I could just go off on one. So just, that's the point about social life. Somebody here, you Emma, could share this if we were totally saying, no, hold on, we've had enough of you. But now you can't. I got the camera and I'm moving on. Let's imagine that I want to go down to O'Reilly's and I want to have a pint, okay? Well, I can't now, really. Yeah. However, supposing we change the nature of our experience of hotel, our experience of entertainment, restaurants and things, and included a consciousness of hygiene in it that hasn't been there. Indeed, made that social. We'd only be going back to Constantinople, to the east, to Rome, where the ablution was part of the experience of the imbibing. You didn't actually have the jacks out the back, and goodness knows at what level of hygiene was there. It was a process in which you came and washed. Indeed, in the Quran, in the Holy Bible, the washing of the feet came before they sat down for the Last Supper. Why? Because it was absolutely inherent that we would wash and clean. Okay, now I'm not suggesting we go back to barefoot at all, but I'm suggesting that sometimes the technology that has distorted us has been this very technology that has led us to the proximities that put us at risk of contagion, which is not new at all. And we've lost a social intimacy around cleaning about, and I don't mean in an obsessive compulsive way. So supposing, in other words, if you went down to Searson's, the outside of it, the first room was actually a kind of sauna. Now, let's imagine I'm going for a pint. Well, actually, that means I'm going to expect to be hand washing in a way which is not unpleasant at all, in a way which is quite social. And now I'm with people who know I do that, and we all do that. It would be a change, but not actually something that is terribly radical. If you got the idea that I mean, I'm joking about it in terms of structures, but I'm saying we did think that you could go from one Starbucks to another block and another Starbucks with a bun and a can in your hand and not have to wash your hands. But you do, actually. And now we realize that we just forgot about one of the tenets of intimacy, which was respect for each other's space and respect for the hygiene of our environment. Indeed, this is an environmental wake-up call, which might actually have industrial and will have educational and personal significance, but they're not new insights. We always did need to make cities work by making them clean. And if you look at, if you compare, say, the American states that had lower level incidence and those that had high level incidence initially, it was the cities with large migrations and huge populations that were hit first. But all the other cities, even the ones in the open area, ultimately got it. And now it's the big spaces of Texas and Montana that are getting it. So it's not inherent in cities or in urbanization or in technology to be infected. What's inherent is our loss of recognition of our need to respect the environment and the environment we share. And that provides opportunities which I think would be culturally relevant. So I really think that the normal won't be new, and there isn't anything that we haven't really to be afraid of if we're prepared to learn about what it is to be human, to share, to connect with each other. And I'm somebody who doesn't believe in Rousseau's idea of the noble savage out in the open air. I like cities, I like towns, I like busy offices and places where we all come together. And I think we can make those safe places by realizing that was always the challenge. When they built Rome, it was always about where would they get the cistern and heat the water clean. And that's what we need to do. And we did forget that at the expense of coffee to go and a disregard for what was always there, which was infectious disease. And we did disregard it, and we're paying an enormous cost for it. We disregarded public health, and we've been disregarding mental health for a long time. In April, an American citizen died every 45 seconds of COVID-19. We've got nearly 4.5 million cases with nearly 500,000 deaths worldwide. But every minute in the world, somebody dies of suicide. The real failures in the marketplace and in our homes and in our societies are failures in health terms to recognize relational health. Health about your health, Emma, and my health. Your health and my health. And their public health and mental health. And we invest in individual health. In other words, transplants and high-tech stuff. And hell, if I need one of those, I want them. But that's become the supremacy of the individual over the necessity of the society and the collective.
I might just, thanks, Jim. I might just stop you there. We've had a few questions come in from the audience. So I just wanted to address a couple of those. Colman, this is possibly one for yourself. Is there any resources that we could use to maybe help our employees with children, to help their children with their mental health? Is there any, resources there that you direct them to?
I would suggest that families are overloaded with resources at the moment. You're getting 25 emails from school every day to do this exercise, and the idea of go out to the garden and find 2 hedgehogs and draw a picture of them, like, that's labor in terms of parents. It stresses people out. They're getting completely overwhelmed with trying to keep up with the WhatsApp group of other kids who've done 2 hours of Latin this morning, and you're trying to scrape past a bit of drawing. So I wouldn't be overloading people with more resources. What I would say is, for families, it's about the culture in your home. Your home has to feel safe. It has to feel okay. It has to. It's much more useful for you to watch a movie together, to go out for a walk together, to do something that's enjoyable, as opposed to trying to find activities. I think there's another question there around trying to motivate people through online quizzes and yoga chats and things like that. And, people, again, will enjoy that at the start and may become a bit tiresome of it as it goes along, and it can be a one-way street. But I'd say to people is, you need to keep people connected. And so you're giving people maybe more what they need than what they want. And I would continue with that and try. We can't mimic real life. We can't replicate, but we can kind of mimic it. I would keep going with those things. I think the thing that gets us to connect is, sometimes we'll say, I'll do something when I feel better. In actual fact, when you do something, you feel better. So it's actually the doing first rather than that. So I'd keep going with that. But as for the resources, it's just, I would support families to relax, to enjoy their time, to enjoy time together, to go for walks and give space for that. Because I don't think families need any more tasks, if that's anything.
Great, thanks so much. So just for you both, really quickly, because we're coming to the end, if you could give one piece of advice on how we can mind our mental health through COVID-19, what would it be?
I'll go that. I think reduce your expectations. You're in a survival phase. You're not supposed to be thriving at this moment. It's just about getting through it. If you don't get the schoolwork done, if your kids are not, entertained 24 hours a day, if you don't feel on top of it, that's completely normal. And give yourself a break. This is tough times. Even every psychologist, myself and Jim, unless we were 200 years of age and lived through the Spanish flu, we don't have the answers to this either. We're all just trying to make do and try the best we can. So give yourself a break, reduce your expectations, and just try and get through it would be my advice.
And Jim, very quickly from yourself, because we're up on time now.
It begins and ends with kindness. It begins and ends with kindness. And so any aspect of your day which is basically unkind or unkind to yourself, I'll give an example. It's not good to yourself to stay up late. Get to bed. Sleep is a really important thing, and actually it's a really calming and kind thing to do, to give yourself an early night. Everybody should do that tonight. Give yourself an early night.
I'll definitely take that one on board. Okay, everyone, we've come to the end of this session. Jim, Colman, thank you for your time. It's been thoroughly enjoyable listening to you both. To our audience, thank you for joining. For the next 15 minutes, you have the option of joining our networking session where you can have a chat with one another, or join a breakout session with Chris Gilmore, Zevo Health's Business Development Director, and he'll talk to you about wellbeing programs within your business. So you can just click on the buttons to the left there, sessions and networking, and enjoy. Thank you very much. Great ending. Great ending.